Hello everyone, I am a faculty at Metier Academy. My name is Rusha and today we'll be discussing about OET speaking. There are a lot of questions related to it, like how should we start, when do I know that it is a known case or an unknown case. I'll tell you three things that is going to give you a clear picture of how do we understand whether it is a known case or an unknown case. All right. This video, I'll be using both the languages, even for the Hindi speakers and for the English speakers. I hope this will be useful for you. So, अब हमें कैसे पता चलता है कि OET speaking में whether it is a known case or an unknown case. So, those who are new and those who have not given OET even once, let me tell you and let me brief you a little bit about OET speaking. First thing is, OET speaking, in the OET speaking, when you enter the hall, they will ask you warm-up questions, and then 2 role plays will be conducted. After the warm-up session, they will give you 3 minutes of preparation time and 5 minutes to complete the role play. So, what do we do in this 3 minutes of preparatory time? And yes, remember that you will be recorded during the role play. Okay, so my question to you is, what do we do during that 3 minutes of time period? So first, we read the role play and try to summarize it by understanding it completely. Try to understand the core of it. What are they trying to talk about? What message do I have to convey the patient? How am I going to start the role play? Do I have to introduce myself or not? Should I ask the name of the patient or not? And how do I conclude it? There's another element which is very important, that is your intonation. Okay. So we'll be discussing all of these information and then so that you won't have any doubts regarding OET speaking. So this role play over here, this is the nurse's role play, as you can see, and this is patients, that is the interlocutor. Remember, the person in front of you is not your examiner, so don't be afraid when you are sitting in front of them. Okay, so जो इंसान आपके सामने आपका स्पीकिंग ले रहा है, that person is only the interlocutor. That means वो सिर्फ आपके साथ एक रोल प्ले करने के लिए कुछ set of dialogues जो उन्हें दिए हुए हैं, they're going to read the dialogue. That's it. They're not examining you. So don't get intimidated. If your exam is coming up next week, don't get scared. Definitely you can ace it. Be confident. Now let's talk about the role play card. This is the patient's role play card. Okay. And this one is nurse's role play card. What do you have to do? First, look at the setting. It's a clinic. You need to imagine yourself that you're in a clinic. Okay? Outpatient. It's not an inpatient. All right? Then your patient is 51 years old. Now they've given a little bit detail about the patient, which will be there in all the role play cards. They will be telling you about the age and the diagnosis of the patient, who has a lesion removed on from his or her hand following a diagnosis of squamous cell carcinoma. So now we know the diagnosis of the patient. He or she was exposed to the sun and you have come to remove the stitches. Now, forget all the other things. Your focus should be this part. All right? All right? It says, you have come to remove the stitches. That means you have already met the patient. So, is there a need to introduce yourself or ask for the name of the patient? No. All right. You have come to remove the stitches. You're simply going to state the condition, state about the observation, and start with the first task, that is to confirm the reason of visit. Now, a lot of time we see this reason and then जो हमने रटा हुआ होता है हम उसी चीज़ को बोल देते हैं. May I know the reason for your visit? No, we're not going to do that. Here they're asking you to confirm. There's a difference between confirming and asking. Okay? If it says ask, then you can simply say, may I know the reason for your visit? But if it says confirm, then you need to say, if I'm not wrong, you are here for stitches removal. You need to state it. They're not telling you to ask the patient. You already know the patient, you no need to ask him. Okay? You simply have to state the reason. So, Mr. John, you've come here to remove, I've come here to remove your stitches and do the wound dressing and cleaning. Then, after that, they have stated find out the concerns of the patient. Can you see that? It says to find out. Okay, find out. That is your first question to the patient. All right. Many people suggest you ask, how are you? If it is a known case, supposedly, simple फंडा है about known and unknown का. अगर आप किसी को जानते हो, आप already मिल चुके हो, आप फिर से उससे तो नहीं पूछोगे नाम, isn't it? Then why are we asking name in unknown cases? All right. And if it is said कि आप already patient को assess कर चुके हो, you've already taken the vitals, or you've already assessed the patient, then why are we sitting and asking how are you? No, we already know how the patient is. We already know that we've come with the purpose to remove the stitches. So we'll simply state that, Mr. John, I've come to remove your stitches, do the wound dressing and cleaning, and I want to know your concern. Do you have any concerns? Okay? There are various ways of asking concerns of the patient, as you must have learned. May I know your concern? We can simply ask, may I know your concerns, or what is bothering you? Do you have any query? Do you have any questions for me? So, these are all the ways of asking concerns of the patient. Okay, this is it for today's video. We will be discussing more about skin cancer in the upcoming video. Do like, share and subscribe our channel. Thank you.